Welcome everybody. My today's mission is to discuss something about diarrhea. Diarrhea is one of the trio of infectious disorder. Others are fever and respiratory tract infection. Diarrhea means loose motion. Loose motion above 5 times a day. It is 5 times a day. Anyhow, diarrhea could be developed by different cause. Number one cause is allergy. Number two, allergy to food. Second cause is infection, that is invasion of parasite, Giardia, etc., bacteria, protozoa, Giardia, etc., virus, and chronic infection. Chronic infection means even tuberculosis. Children diarrhea, one of the major cause is tuberculosis. And hypoproteinemia. When the protein is minimum, enters within the body, then it causes some metabolic disorder and diarrhea also. So during the treatment, we have to be cautious about all those factors. Diarrhea also one of the important significant disease cause that causes different future problems. Malnutrition, so anemia, chronic anemia, then invades the other infection disease, tuberculosis even, that is tuberculosis causes diarrhea and diarrhea invites tuberculosis. So treatment of the diarrhea is very important, and in my personal life I felt at the beginning many cases of diarrhea. But I identified most easy process of treatment of diarrhea later within 3 or 5 years that I am going to narrate you. Number one, whether any weakness is present or not. If there is no weakness but diarrhea is continuing, persisting, the main medicine is acid phos sulfur tuberculinum. You may apply ignitia carcinosinum also, as these are incoordinating. Number second, if there is weakness, we have to apply China immediately. If there is redness of rectum, sulfur, chamomilla, arsenic sulflavum. Sulfur, chamomilla, arsenic sulflavum. And if the stool is passing with much sound, less stool, much sound, aloes secretina. If the stool became green, while it passes yellow, but later became green. 3 or 4 remedies is present. First is argentum nitricum, second is rheum sanicula. Nitric acid also has these symptoms that I clinically varied in 15% of cases. In 100 cases, 15% I have verified nitric acid. Undigested food, undigested stool, China, iodium, etc. And patient is hungry, diarrhea, iodium, calcarea iode, ferrum phos, etc. Diarrhea in pregnancy time, patient has vomiting, skin disease, thyroid problem, diarrhea. Now patient has been suffering from diarrhea with vomiting or simple diarrhea, thyroidinum. And yes, patient is thirstless, pulsatilla arsenic, not drinks properly while he has diarrhea. Pulsatilla arsenic, patient is thirsty, common symptoms. But if you prefer ice cream, you may apply phosphorus, ferrum phos, natrum phos. Suppose I cured one relative baby, blood dysentery, diarrhea, serious condition. Patient used to take bitter, preferred bitter. I prescribe natrum phos, 50 millisimal, and patient cured. Natrum phos. Patient want bitter. Patient eating charcoal. That is many medicine we have. Nitric acid, alumina, calcarea, natrum, causticum, ferrum, cicuta, etc. Involuntary stool passes anytime. Muriatic acid in adult. BCG not reacted, diarrhea, bacillinum, diarrhea after vaccination, one type of allergy. I have treated many cases, many hundred cases. Thuja. These are the common medicine. If we apply following the symptoms, we get success in every cases. Potency 0.1 or 6 or 3x from the low potency. Because vitality become weak, we have to apply low potency. Repeated dose, 5 to 15 minutes interval. Repeated dose, even where the severe diarrhea developed. One potency, suppose 50 millisimal that I am using, 15 minutes interval, 25 stroke, within hour, one potency jumping. Then second, sulfur 0.1, 4 dose, 25 stroke, that is that divided into 4 dose. After 100 stroke, that reach to the second potency 0.2, then again apply 0.2, 25 stroke per dose or 20 stroke per dose 4 times, then 0.3 potency. On that way, rising potency, quick rising potency, that cures violent diarrhea. In West Bengal, different type, epidemic diarrhea, blood dysentery developed, and many hundred became dead. Sudden and violent onset. Aconite lag, aconite nap, aconite far. Same potency. I applied aconite nap, aconite far both primarily aconite nab, then aconite far also applied. Blood dysentery, aconite nab, green dysentery. Very effective and curable. After the diarrhea, sodium sulfur we have to use after cured. Sodium sulfur. If necessary, tuberculinum. After acid phos, we have to apply tuberculinum. After sulfur, we have to apply sodium as a cognate, as a complementary to cure its root. Chronic diarrhea means tubercular diathesis, so we have to apply tuberculinum. Repeated application. Chronic, you apply Diarrhoea after eating hot weather. What does this mean? Yes. Ice cream, eaten ice cream. Diarrhoea cured the disease. Next time, phosphorus, that it has strong desire to eat ice cream. Then tuberculinum to its chronic effect. Patient came from on traveling hilly area. We are living in hot climate. Patient came after hilly area, returning from hilly mountain. Dalkamara, best remedy. Nags vomica, repeated urging, stool and urine, vomiting with abdominal pain relieved after stool. Mark sol, much staining, greenish stool, mark doll in case of children, mark doll. Bloody stool, mark cor. White mucus, mark sol. Repeated dose. After relieving the symptoms, we have to apply cipilinum or carcinosinum to cure the root of the disease. These are the common treatment of diarrhea. I hope you will get much success in your future life. Thank you. We will meet again later.